Welcome back to the Hampton Roadshow. According to the Centers for Disease Control and Prevention, aside from non-melanoma skin cancer, prostate cancer is the most common cancer among men in the United States. Here now to share some risk factors and health tips is Dr. Ifeanyi Ani from Tidewater Physicians Multi-Specialty Group Urology. Welcome to the Hampton Roadshow.
Thank you. Thanks for having me.
The other thing that prostate cancer has in common with the non-melanoma skin cancers is its cure rate, if it's caught early.
Correct.
Okay.
Correct.
So what do you want men to know about screening and seeing a urologist?
Sure. Well, screening is very important. You know, the United States Service Task Force had released a lot of recommendations. Now it's been updated from a grade, from a recommendation D down to a C, indicating that it's beneficial to actually have screening. Early detection is the biggest key. If it is detected early, then you can receive cure, and prostate cancer can be controlled very well, and patients can do very well. And multiple studies do show that it does help improve survival, especially for patients that have at least 10 to 15 years or more of life expectancy.
Okay. So we've been talking a lot about prostate cancer and raising awareness for that too.
Correct.
But some men may wonder, well, if I have a primary care doctor, do I need to see a urologist, and what other diseases besides prostate cancer are you looking for when it comes to men's health?
Well, in general, for men's health, there can be some genetic constellation between prostate cancer and other men's health.
Okay.
There's some familial diseases where you can have association with, colon cancer. You can have associations with, breast cancer. Men can get breast cancer as well. So there is, as we talk about, we're more common with women, things like genes like BRCA1, BRCA2.
Yeah.
In men that have aggressive prostate cancer, you can find those genes, and that may be an indication for potential family-related cancers that may help you discover those things.
Okay, so it's important to get the total picture of your health, but sometimes you see the signs in a specific area.
Exactly, and it is important. The primary care doctors do play a significant role. It's important for them to understand the importance of that screening and the early detection to be able to know when to appropriately refer the patients to see a specialist, such as a urologist or a medical oncologist.
I don't want to paint with a broad brush, but I know sometimes for men, they're just not eager to make the appointment, take the time, wonder about the expense. Does insurance cover routine screenings, preventative screenings?
Yes. Okay. Most insurances will cover preventative screening. It used to be a little bit challenging, especially for the Medicare population, with some of the recommendations that were made. But now it is covered. We used to have some pushback from Medicare when it came to PSA testing. But with the changes in the new recommendations, Medicare is covering PSA checks. So for men that need screening, there should be screened. And there's a little bit more to that. Patients need to understand that actually, if you have a strong family history of prostate cancer, you need to start your screening on early detection much earlier than what some of the recommendations have, such as, say, at 50. In some cases, you may need to start it at 40 years old, especially if your father, brother has had prostate cancer, or you are of African American ethnicity.
Okay. All right, good tips today, especially thank you for sharing what you've learned about the relationship between Medicare coverage and some of the PSA tests, which is simple. It's a blood test, right?
Yes, exactly. It's a simple blood test that you can get at your primary care doctor's office, any other physician's offices.
All right, no big whoop, because if you're a man, there's a good chance you're a dad, a brother, or a grandparent. People love you and want you to stay healthy, so get in there and do what you got to do. To learn more about prostate cancer screening and treatment, get in touch with Dr. Ani at TPMG Urology. They're at 860 Omni Boulevard, Suite 107 in Newport News. You can call them at 757-873-2562 or visit mytpmg.com. Dr. Ani, thanks so much.
Thank you for having me.